Hi, my name is Jake Darling. I'm going to be demonstrating how to insert an indwelling Foley catheter today, as well as its removal. So for demonstration purposes, we'll just pretend the bed is actually above the level of my waist, same with the desk. So we'll just get right into it. So we're going to review the physician's orders. So for today's date, February 7th, 2021. So for the patient, nursing Jake, date of birth, January 1st, 1960. The number 312-654-987. So we have an order for the insertion of indwelling Foley catheter to monitor the patient's ins and outs due to their nausea and vomiting related to their chemotherapy treatments. And we can also see that the patient has no known allergies. So I'm just gonna perform hand hygiene, collect my supplies. So I have my catheter insertion kit, I have my sterile gloves, my drainage bag, and my 12 French Foley catheter. So I'm gonna bring those into the patient's room, set them down, I'm gonna perform hand hygiene, do my entrance safety check. There's no hazards on the floor, patients in no distress. So hi, my name is Jake Darling, I'm a student nurse at the University of Manitoba. Can I get you to state your full name and date of birth for me, please? Okay, I'm just gonna confirm that with your wristband. And you have any allergies? No? Okay, yeah, that's what we have on your chart. Name and your date of birth match what we have on file, so that's good. So just to explain the procedure to you, today I'm going to be inserting an indwelling Foley catheter. It's basically a rubber tube that's inserted up your urethra into your bladder, and it's held in place by a balloon filled with sterile water. And so pericare was already performed prior this morning, and so now I'm just going to position the patient in the dorsal recumbent position with their knees flexed. There's an absorbent barrier underneath them. And yeah, so now I'm gonna get the drainage bag and attach it to a non-movable part of the bed. Obviously on this bed, I don't have that luxury. So, such as the bed frame, so we're just going to pretend that's right there. Loop the tubing over here to the side. Okay, so now perform hand hygiene, and we'll get into this. I'm just making sure that we touch just within the 1 inch border to maintain sterility. The garbage bag, just set this up between the patient's legs, the foot of the bed. And we have our catheter, so we'll just wing this open, pretend this hasn't been opened prior. And remove the sterile inner packaging. Oh, so that remained inside my 1 inch border, so that's okay. Okay, so I'm going to perform hand hygiene. I'm going to don my sterile gloves. And these gloves have been worn, have been donned so many times that they're a little on, but still make it work to maintain sterility. Okay, so that, hands above the waist. Touch our sterile water. And we'll lube up the tip of the catheter, just 2 to 3 inches. This is for a female patient. Adequate amount. Move cotton swabs. Okay, so now we can transfer the boat between the patient's legs. Alrighty, so now I can sterilize the patient's private parts prior to insertion of the catheter. So this hand has to remain sterile. This is my non-dominant hand, so I'll use this. Okay, so now I'm gonna do the far side. Nearest side and right down the middle. Okay, so now I'm just going to request the patient to just bear down as if voiding. Take a few deep breaths. I'm going to insert the catheter, approximately 2 to 3 inches. Okay, so I see urine return, so I'm going to go an extra 1 to 2 inches just to ensure that I'm in the bladder. And then I'm going to stabilize with my non-dominant hand and slowly fill up the balloon. Okay, so now I'm just going to check, slowly pull back on the catheter until I meet resistance. So I meet resistance, so I know it's held in place good. So now I'm going to take this hand and remove the syringe, the waste, and go there. As it continues to drain, and then I can note how much is draining later. So now remain maintaining sterility. Attach that to there. Okay, good. So now I can attach this to the patient's inner leg. I can perform pericare. So then I would then clean up my mess, remove my gloves, wash my hands, and then make sure the patient's in no distress. Call bell is within reach, and bed's in lowest position. Side rails up on the side rails are up on the bed, as per hospital policy. And then I leave the room, so I'm going to document the procedure. So as per physician request, I inserted an indwelling 12 French Foley catheter with a 10 ml balloon. Patient tolerated the procedure well. It was noted that there was 200 mLs of clear amber urine drained during the procedure. We'll continue to monitor the patient's ins and outs, as well as for any signs of infection. So now I have a new order.
Hi, you have a new order. Physician has ordered to actually remove the Foley catheter.
Okay, so now I have a new order for the removal of the indwelling Foley catheter on my patient. So first I'm just going to review the patient's chart of the order. So I do indeed, for nursing Jake, date of birth January 1st, 1960, phone number 312-654-97, has an order for the removal of their indwelling Foley catheter due to the resolution of their nausea and vomiting. So now I'm gonna wash my hands, and I'm gonna wash my hands and collect my supplies. So I'm gonna grab my sterile gloves. I'm gonna grab a new syringe. I'm gonna grab an absorbent barrier to place underneath the patient and to wrap the catheter in, as well as a drainage bin to drain the urine. So I'm going to enter the patient's room and do my entrance. I'm gonna wash my hands. I'm gonna do my entrance safety check. So there's no hazards on the floor. Patient's in no distress. So now I'm going to just introduce myself. So hi, my name is Jake Darling. I'm a student nurse at the University of Manitoba. I'm here to remove your indwelling Foley catheter for you today. Can I get you to state your full name and your date of birth for me, please? Okay, great. Any allergies? No? Okay, great. That's what we have on file. So that indeed matches your wristband. Nursing Jake. Date of birth, January 1st, 1960. FIN number 312-654-987. Okay. So now I'm going to don some clean gloves, and I'm going to drain your bag. So I'm going to make note that there's 1,000 mLs of clear amber urine from the bag that I drained into the tub. So now I'm going to position the patient in the dorsal recumbent position with their knees flexed. I'm going to put the blue absorbent barrier underneath their bum to ensure that the bed doesn't get soaked. So now I am going to attach the syringe to the port. I'm going to make sure that I clear it out, drain all the water. Make sure I hit 10 mLs. And okay, so I have, pull this out, make sure I do have 10 mLs. And sorry, just to explain this to you, I'm just ensuring that there's no more water in the balloon so that it's not going to be held in place. It's not going to be painful when I remove the catheter for you today, and just so that you have some explanation of the procedure I'm performing for you. Sorry about that, I should have mentioned that earlier. So now that I have that pulled out, all drained out, and I got all 10 mLs, so I know the balloon should be 100% deflated. I'm gonna ask the patient just to take a few deep breaths and bear down. I'm just gonna slowly pull it out. So inspect the tip's intact. So that's really good. So I'm just gonna wrap up the catheter, throw the whole system away, the whole kit away. I'm gonna perform pericare. I'm gonna then remove my gloves, wash my hands. I'm gonna make sure the patient is in no distress, that their call bell is within reach, the bed's in lowest position, arm rails are up on the bed, that the patient has no last request. So is there anything else I can do for you today? No? Okay, great. So now I'm gonna exit the room. I'm going to document the procedure now. So as per physician request, removal of an indwelling 12 French Foley catheter with a 10 ml balloon. Patient tolerated the procedure well. There was 1,000 mLs of urine drained from the bag, clear amber colored urine, and that and then I'm going to continue to monitor the patient for any sign for them to void within the next 8 hours. So it's currently noon, so by 8 p.m. tonight they should have voided by then. Otherwise we may have to check with a bladder scanner. And yeah, so thanks, and scenario.